Hi everyone. So this is my last YouTube video before my jaw surgery that's coming up like quite soon. For those who are wondering why I'm going in for a jaw surgery, it is part of my orthodontic treatment for my braces. Now, as you can tell in some videos, you can slightly see that I have braces. I've had them on since February of this year. Anyways, so the reason I'm going in for jaw surgery is because, I don't know if you can tell, but I have a bit of an overbite problem. Now my chin here hides most of the problem, but if you see an actual x-ray that I've got done of my jaw, you'll see that there is a problem. And so basically this surgery is mandatory. And if I do not get this surgery, what would happen? I would just do braces then, and when the braces come off, because my jaw will no longer support my teeth because they're straightened instead of what they originally were, by the age of 25, my teeth would all fall out one by one, and I would have to get dentures. So that is absolutely unacceptable. So that's why I have basically no choice for a jaw surgery. Now, I'm not scared about going in for surgery or being put under for a procedure. I'm really not. I'm just nervous because, okay, so I'm gonna quickly describe what they're gonna do. So I'm gonna go into the Dravinsky Hospital here in Hamilton, Ontario. The surgery is gonna take approximately 3 hours. And here's what my oral surgeon, Dr. Harnett, is going to do. So I'm going to be in the operating room, okay, on my back, obviously lying down. I'll be out like a light. I'll be in a medicated sleep. And so what they're doing, they're going to put a device in my mouth to keep my mouth wide open. So my mouth is going to be pried right open for 3 hours. They're going to work from the inside out to correct the jaw problem. So this is how the procedure is going to go. After they put me out and get my mouth open with the device that they're putting inside my mouth, they're going to work from the inside out. And what they're going to do is the jawbone, okay, where I just pointed, that's what they're working with. They're going to cut some of the bone, right, off, so until the jaw starts to slide back and forth at will, right? So my jaw will basically be dislocated for a bit, right? And what they're going to do is when the jaw starts freely sliding on its own back and forth, what they're going to do is that they're going to align it to what a person's bite should be. As soon as they have it properly aligned, they're going to put in plates, wires, pins, needles, to secure it in place. Once they've locked the bite into place, my chin here won't match my face. Actually, my chin will be hanging a bit off my face. So what they have to do after they get the jaw properly aligned and secured, they have to reconstruct my chin to be back on my face and match my face. And after they're done that, I was originally told that my jaw wasn't going to be wired shut. So when people asked me, am I going to have my jaw wired shut, I was answering no. Well, apparently now that's not the case. I got my last tightening and my final surgical wires onto my brackets by my orthodontist. And basically there's hooks in these surgical wires, the final surgical wires that they put on your brackets. They have hooks in them. So those hooks is going to allow my oral surgeon to put another wire connecting from the hooks to the jawbone. And it's going to stay like that until the bone has healed itself. I don't know how long that's going to take, but yeah. Now, jaw wired shut. Some people might be thinking, oh, well, you can't open your mouth at all. How are you going to eat? Well, answer simple. I'll be able to open my jaw a tiny bit, enough to allow a straw that where I'm going to be sipping my soup and other liquid nutrients from into my mouth and into my body. And then it's going to be like that until the wire comes out and the hooks are no longer needed. So that's what's going to be happening. And the recovery time I was told 6 weeks of recovery time. So that's 6 weeks of no YouTube video updates. That's 6 weeks of me being at home in bed, basically, with my medication to make sure that I'm not in that much pain or discomfort. And it's six weeks of recovery. So, and unfortunately, I haven't had time at all to pre-record some YouTube videos. So whatever is on my channel is what you people out there are going to be left with until I am fully recovered enough to make another YouTube video update. I don't know when that will be. It can be before 6 weeks, it can be at 6 weeks, or just after 6 weeks. All depends how fast my body wants to heal itself. So I'm not giving you a time frame as to when the next YouTube video update will be on my channel. I am not going to promise that I'm going to make another YouTube video update in this amount of weeks or this day, because I just don't know how well my recovery is going to go. It's going to be a bit rough. I'm going to have people come and help me with my apartment, with my dog. My close friend, I might have to give her my bank card to do some banking and pay some of my bills with my bank card. So, well, we'll see about that. But yeah, so the CAS worker wanted me to stay at somebody's house. I'm like, no, I want to be home with my dog. I feel much more better recovering at home. I don't want to stay at someone's house for several weeks. So I'm going to be here at home with my dog. I'm going to have people coming all the time. So I might be alone for a couple of hours, but I'll have people coming over to help me and make sure I get the nutrients in my body and that my medication's properly taken care of and that I'm fine, my dog is fine, right? So, but yeah, so that's why I'm not going to be able, you won't see new YouTube video updates for a bit, and unfortunately wasn't able in time to make pre-records, so sorry, but I will make a YouTube video update as soon as I'm better. Now, the result of the surgery, I will still look natural. I won't look fake because it's not plastic surgery. They're literally working with my jawbone and the muscles in my chin. So they might have to shave some skin off, but it's not plastic surgery. So I'll look better. I'll look a bit different, yes, but I'll look better. I'll have a proper bite, a proper jaw structure, and then a couple months after the surgery, my braces will be coming off and my retainer will be going in. So I'm almost done my treatment. The treatment for my braces in whole, with including the surgery, was supposed to take at least 2 years, but because I've been going for tightenings every 2 to 3 weeks, they're coming off just before or a bit after my 1-year anniversary of getting the braces put on. So I'm looking around February, March, somewhere in March, the latest, that my braces will be coming off and my retainer coming in, most likely, hopefully. So I want to thank you guys for viewing my YouTube channel and subscribing and taking the time out of your day to view my updates. It means so much to me to know that the views that my videos do get a good amount of attention, and I'm not just doing this YouTube channel for nothing. So I want to thank you guys from the bottom of my heart for tuning into my videos and taking the effort and time out of your day to do so. For those of you who view my channel, who's on my Facebook, I'll be on Facebook, obviously to chat and whatnot, but as for YouTube, SOL for now. Alright, I'll be fine, don't worry about that, for those who are going to be worrying. Yeah, it's just going to be interesting now. It's going to be something I've never done before, and this surgery is very expensive. My children's aid worker is paying for every last red cent of my treatment and my braces, so thank God for her and the agency, because this is expensive. Now, like, my smile entirely is going to be close to a $10,000 smile, probably just at $10,000 worth of money for the treatment. So my smile is going to be an expensive one, but you know what? It's worth it in the end, right? It has to be. So yeah, so I just want to do this video just to inform you guys about that, and just watch my YouTube videos, I guess. No one's already here, and I will update you guys when I am well and I can speak and I can move my mouth properly. So don't forget to comment, share, and subscribe down below here, and leave me your thoughts of any, and I'll catch you guys in maybe 6 weeks. Ciao.